If losing weight is a constant struggle, you've tried all sorts of diets and other programs with no success, the Weight Loss Institute of Arizona is here to help. Joining me now is Dr. John DeBarros, along with lap band surgery patients Gail McFarland and Patty McCurry. It's good to see all of you. Thank you for joining us. I'm going to start with Dr. DeBarros first, though. Dr. DeBarros, what qualifies somebody for the lap band procedure?
Essentially, you have to be about 50 pounds overweight or your BMI of 35. That's according to the Department of National Institute of Health guidelines, BMIs of 35 and greater with at least one medical problem. Okay. However, recently the FDA has come out and said that BMIs of 30 or greater would be a reason to qualify somebody for a lap band procedure.
And how does the procedure work?
Very simple. A lap band is a procedure where we place a band along the upper portion of the stomach and we just suture it into place. And essentially when you eat, food will go through the area of the lap band, and a lot of the food will remain above the band, and food will trickle through over time, which will have patients eating at a much slower rate, and then over time, through stretching a lot of the nerves and hormones that are released in that area, will also cause a feeling of satiety, like you don't want to eat anymore. Ah. So that's essentially how it works.
Okay, and both ladies here had the procedure done. And tell us about what happened with you, Patty. I know you saw the before and after shot. She went, oh!
Yes, I had chronic back pain. I was due for surgery, possibly back surgery. Oh. And I was so heavy that I could no longer exercise to try to get the weight off or anything. So my pain management doctor was suggesting surgery. And then we started talking about other options, and I asked him about the lap band surgery, and he was all for it because he had a friend that had it done and seen the results. So he signed the paperwork and wanted me to check into having that done, which I did.
I saw the before and after. How much did you lose?
I've lost 81 pounds.
Wow. Wow. Yes. I know you couldn't believe that was you.
Oh, yeah.
That is hard to believe that's you, actually.
It is. That was me.
Wow. So obviously you didn't have to get the back surgery?
No.
That's wonderful.
No, I'm no longer having the chronic pain that I experienced.
Very important. Gail, was it a similar story for you?
Yes, mine was my knees. I had to have knee surgery, and my doctor wouldn't talk to me until my BMI was under 40.
Mm-hmm. Oh.
So, because of infection.
Oh, so you went and you had the lap band, and how much did you end up losing them?
I've lost so far 145. I lost 94 before surgery, and I've lost 50 after surgery.
So dramatic changes here in your life. I mean, you went from not having surgery, you were able to get it and feel better. Any other thing you've noticed with just having that weight gone?
Yes, I'm able to walk. I walk 4.5, 5 miles a day now, so I'm just very active.
That's wonderful.
Yeah, where I was, I could hardly walk. I mean, in the house, it was a struggle. I was almost homebound.
Wow.
Yes.
Wow. Well, I'm so glad to see you both here smiling and happy. Dr. DeBarros, what qualifies somebody who wants to get this procedure, and how can they have that kind of success these two ladies have had?
Well, essentially, they're both in a process. When we see patients who are band patients, we look at the best surgery options for them. For these two patients, with what they wanted to achieve and what they were willing to risk in terms of surgical options, lap band was a very good choice for them. And, they're both in the process. To me, it's a lifelong process. Mm-hmm. So when patients come to see us, we have an initial consultation where we discuss with each patient on the best type of surgery for that particular patient. Then, if lap band is the option that they want to choose, we proceed to get them ready for the band. Some patients have 3 to 6 months of diet and exercise. And then we will go ahead and perform the band. We would have their insurance, our insurance specialist will go through and get all their insurance things up to speed so that they know exactly what their issues are in terms of what their insurance will and won't cover.
And I know you follow up with the patients, there's patient support, there's a lot that goes along with it to make sure that this is a successful journey for everyone.
Correct, because it's not really about surgery, it's about success.
Right.
And that's what we're looking at. We're looking at how we can best get these patients to where they want to be with the least amount of surgical intervention as possible. And if lap band is the case, then that's the case.
Yeah.
Right now we are actually in a trial with a different type of procedure for a lap band. It's called lap band with gastric plication. But this some patients may qualify, and if they're willing to come and talk to us about the procedure, we're willing to explain all of the things that go along with it.
Okay, great. Well, thank you all for joining us. Thank you for seeing. Good to see you again, Dr. DeBarros, and
Nice to
congratulations
see
to you both.
Oh, thank you.
If you would like more information, of course, about the Weight Loss Institute of Arizona, you can go to their website. It's WLIAZ.com, or call the number you see right there on your screen.